नाज़रीन, मां आख़िर में तव्हां जो वरी बि इंट्रोडक्शन तो करायां डॉक्टर हफ़ीज़ अब्बासी, जेको मशहूर कार्डियोलॉजिस्ट आहे। सिंध सुधार सोचुनि में हू अॻु में बि अची चुको आहे ऐं इन्हनि इशूज़ ते ॻाल्हायो अथई। अॼु वरी हू पंहिंजूं कुझु सलाहूं तव्हांखे पेश कंदो।
My number are काफी I'm really happy कि तकरीबन 100 का मारवा है। मुझे next talk 10-12 minutes आया हुआ especially for ladies ना है। मैं especially क्या कही पर यहाँ ladies की talk ना है। जैसे सारी wives सिकते थी means we are sick also. So it's a both you know. So we both are here and try to please pay attention what I'm saying.
बीमार कर
Now before this is American rule, okay, anybody who's a speaker, I belong to institute, we have to disclose that do I belong to any community, any pharmaceutical, I have nothing to disclose, my pockets are empty, I have no money in my pocket from any company. Now my next talk will be is a Takotsubo cardiomyopathy, which is called broken heart. Probably this is not being diagnosed in Pakistan. Recently trained as a start in America. It started basically from Japan. So really pay attention, this is a new disease coming on side and more diagnosis being done and more cases are being diagnosed. Every time I talk my lecture in the past few years, I tell people that everybody gets heart attack when their artery closed. Now look at the animation. When your artery closed, it starts the plaque ruptures, and then it gets blocked, your artery gets blocked, and you get the heart attack. Today I'm going to show you the other side of the coin. Not necessary. Your artery is open, but despite of that, you can still get the heart attack. What is that? That is called broken heart and Takotsubo cardiomyopathy. How are we going to do? I'll show you today. These are a couple of the things, okay, which I really collected from my collection. Okay. You see, everybody says these are the normal coronaries. We all human beings have 3 coronaries in our heart, and you see they are completely normal. So yeah, this is completely normal, there's no problem. And this is a normal heart, how we do the LV ground. Now next picture, please try to see again, I'll play again. This is completely normal coronaries. Okay? Now you see this picture, which is kind of a little bit scary. This is different or not? Heart is abnormal, coronaries are normal. What is called? Basically, Takotsubo cardiomyopathy. Where the name came from, I'll tell you next time. Now these are the 2 things I'm going to play at the same time. You can appreciate. One is abnormal, one is a normal. And both have the normal coronaries. You can appreciate that. Meaning coronaries are completely normal. There's no problem with the coronaries, but despite of that, when artery blocks, we get the damage to the heart, which is called broken heart and Takotsubo cardiomyopathy. Where the name came from? This name came from the Japan. This is actually heart belongs like a narrow neck and base but wide. This was used to be by trapping of the octopus, is a trapping part. That's the name came from as a Takotsubo, broken heart, basically. Now the question comes, who is being affected? Sorry, this is all bypass because time is not there. This is a disease basically in the females. 90% of these cases are being recognized and diagnosed in ladies. Who are they? More than 55 years age, menopausal time. Why they are being affected? Mainly is the stressful event. Everybody has stress in the life. When the stress comes, okay, then this condition comes. They get kind of heart attack, which mainly affect the muscles, not the coronaries. What are the stresses which they have? Emotional stress, like a bad news you heard about in your family, this can affect. Unexpected death of loved one, this can affect. Unexpected loss of job, it can affect. Arguments with the husband and the family members at the job and outside, it can affect. Devastating financial loss, it can affect. Gambling to people who play, they lose money, it can affect. Legal proceedings like a court and all these cases, divorce and all these things, it can affect. And ongoing dissatisfaction in the relationship at home, at work. This is the most common in the United States. The last case I show you, she was my medical assistant in my office on Friday. She had argument with my colleague. She went home 6 o'clock. She ended up in the hospital with the same diagnosis. Perfectly normal coronaries. And moving the new house also is stressful. It can affect. Physical stresses, major surgery, orthopedic trauma, severe COPD lung disease, cardiac, non-cardiac procedures, neurologic catastrophes. Okay. Now what's the presentation? Presentation is exactly the same as the people who's having heart attack. They come with the chest pain, they come with the shortness of breath, they come with the syncope, they come with the arrhythmias, pulmonary edema, and shock. So exactly the same symptoms like you are having heart attack. How the EKG look like? Same exactly ST elevation MR, non-ST elevation MR also, as well as the TV imaging. Exactly like you are having a heart attack. Now, investigation when we do it, all the cardiac enzymes are same high, but less quantity compared to the acute MR. So we can get the cardiac enzymes high, we get the CKMB high, BNP when you see the chest X-ray, it shows the pulmonary congestion. Now what is the treatment? Basically treatment is very simple, there is no specific treatment to prevent. Only the thing is that resolution of the physical and emotional stress, usually it resolves within 3 days to 3 months. Completely heart becomes normal. There is no residual effect of the muscle, it's completely normal. If after 3 months it's not going to be normal, if there's another cause, but this becomes normal. If the people who are really symptomatic and whose heart function is very, very low, we give them the symptomatic treatment like angiotensin converting enzymes inhibitor, which everybody knows that. Beta blockers we give them diuretics, and some people who are really, really sick, we put intra-aortic balloon and we give them, and for the temporary support, they get better, they can go home. Now complications, same thing happen. Left heart failure, cardiogenic shock can happen, left ventricular outflow obstruction, mitral regurgitation, arrhythmias, left ventricular thrombus, left ventricular free wall rupture, and the death can happen. So basically, why we are telling, I know you're not going to remember everything, but the basic concept is that what complication can happen and how this is started and who can be affected. Now what to do? So take home message for everybody is that, very simple, to prevent this disease. How are we going to prevent? Number one, keep your wife and loved one always happy. Like I do always, okay? Always listen to her. When you listen to her, I tell you this is not happening. Number three, try not to argue with her and don't engage her in the arguments. And number four, which is very important, very, very important to prevent this disease, write your own propaganda. Problem is over. I tell you this is all stress related. If you try to relieve their stress, this is there's no other pathology. Their ladies are perfectly healthy. They come home to the work. If you follow these four rules, I tell you, your wife, your loved one, your girlfriend, boyfriend, So basically, then honestly, there's no specific treatment. All is stress related. All is stress related. So this is my take-home message to everybody. Please follow. There's no science. You can then driver ka kamal engine ki movie. You ko problem I ko serve my stress.
One scientific question.
हाँ sir.
You see, first thing is that this syndrome is very commonly diagnosed in Pakistan as well. There are more arguments in Pakistan as compared with here because the wife has got more rights here.
Right.
Right.
But I think diagnosis is not there.
Even there is a divorce, you have to give half of your property.
Not there.
Almost.
Not in Pakistan. Here, that's what I'm saying. Pakistan. So in Pakistan, you don't do that.
So one thing more, how will you differentiate between a minor type of atheroma which gives a thrombosis and then clears away by normal process, and you see that
yeah, good
already
question.
is normal.
Good question. I did not go in detail of the really scientific way, but he's asking the questions. They measured the catecholamines. Catecholamines were very, very high in Takotsubo compared to the acute MR.
Both are.
Both are. But I tell you, they found the people who
and what you call very, very high.
I'm coming to that. They went to cellular level. What they found, the people who had Takotsubo, their apical part has the more receptor which convert from the GS to the GI protein. That's why it came out to be diagnosis. This diagnosis did not come easily, like it wake up in the morning and we give the diagnosis. And plus those mild plaques, which you might have, everybody has, okay? Treatment people are taking, they have high cholesterol, but they don't give, it affects the whole heart. If you have a big plaque, it says, listen to me, if you have mild plaque in 2-3 arteries, you know that we have 17 segments in the heart. Not only affecting the apex particularly, because apex of the heart has special receptors. With the stress, they are being affected. So I'm thankful to you. Thank you very much for that. Yeah.
So diagnosis at cellular level.
Cellular level, yes. So, but clinically as well as biologically. Thank you very much. Thank you. Last speaker. Yes. Sure, please.
On lighter note, seditions and husband life. What about wine?
Yeah, we get that. 123 the property kind of main coming was source aside.
So you still don't want to give any suggestions?
It's a group, okay? They have to be cooperative.
Coupon you guys don't get it.
Somebody they some ladies time is shortage. We are sorry for that. We have taken the time because that was not our fault. Honestly, I came very early here, but nobody was available. Now our next speaker, and you will enjoy. He's an excellent speaker. He's an excellent speaker. Say mother sahib dev jo who I say mother sahib.
Memory loss. Memory loss. Memory loss. Strategies memory preserved. And the second topic is, what is the mentality of our corrupt category of Sindhis and what we can do to change.
Maybe both.
Memory loss. Okay. All right, slides natho use kya. Straightforward galaina see. Memory loss is a big problem with aging. Cut-off age is 65 years. Unkha pojade memory loss the that we worry about what is called dementia. All right, and it's important that the palm age the parents. America may life expectancy is 78 years. At 65 years, there's 5% chance of dementia. At 85, you have 50% chance of dementia. 50. So it increases exponentially. Take home message, Peru. When you feel one of your seniors is forgetting, it is not normal. So generally that's not normal. Number 2, memory loss disease memory loss. वो पेरी पेरी शयूं वेंदियूं आहिनि जेकी तव्हां अॼु या कल्ह कयूं आहिनि हफ़्तो पहिरीं कयूं आहिनि साल पहिरीं वारी शयूं यादि रहंदियूं आहिनि memory loss start from immediate. Take home message number 2. पाण चवंदा आहियूं हिन जी मेमोरी त सही आहे 40 साल पहिरीं वारी ॻाल्हि यादि आहे पर कल्ह छा खाधईं विसरी वियो. That's not normal. That's abnormal. Okay. Memory loss सां जे life में changes पई अचूं माना you cannot maintain your checkbook. Driving में भी तकलीफ थे, directions में भी तकलीफ थे, नालन में भी तकलीफ थे, vocabulary वंदी भी वने, that's not normal. So then those things needs to be checked. Dementia is a very bad disease. 60% of all dementias are Alzheimer's dementia. 35% multiple causes and जिनमें strokes है, diabetes है, hypertension है, Parkinson's, head injuries, etc. Here's the bad thing. Brain, whatever you lose, you cannot regain. Anything. You can to some degree, but mostly you can't. So prevention is the key. So tamam mukhtasar time mil so I'll go straight into preventions. Okay. So number one, you are born with genetic predisposition. It's genetically related, you cannot do anything about it. But you can do a lot about the lifestyle changes. The pehliyo step hundo hai wo eliminate the things that can cause or make dementia more likely. So number one is head injuries. Tawani chon ajikal like talk hai football players post concussion dementia. Panja bar jab acha uwa head injury nandpan mein bhi thiye ta wo increases the risk. The helmet, that's not easy, right? Uwa shay jeki brain ke damage kare unke rokna. Example, too much alcohol and drugs. Okay, too much. A little bit of alcohol, brain can tolerate. Diabetes is an independent risk factor, so is hypertension. Jay Marun ke education gatundi previously, that person is more likely to develop dementia. Education has an anti-dementia effect. Of course, depression and smoking. Smoking because inflammation. Inflammation is a big cause of dementia. Okay, what can we do? Eliminate there are a few things you can do that will help you preserve your cognition. I think the ideal person to look at is Jimmy Carter. He's 90 years old, he's still writing books, he travels the world, he uses his brain. So the first important message is brain is like any other muscle. The more you use it, the bigger it gets. It's like biceps. So the brain message on the brain is either use it or lose it. So I think that is the key to keep yourself cognitively intact and sharp. In the very barik detail, that's very important. Brain likes to learn new things. Newness is the important word here. If you're an accountant and you continue to do accounts and you think that is brain activity, it's not. It's like if you make the same tracks, the tracks are deeper, but you're not making any new tracks. Reagan developed dementia even though he used his brain. So new learning is an essential prevention for dementia. One of the best things you can do to learn new thing is learn a new language, because it has vocabulary, it has comprehension, it has pronunciation, it has telling one concept with another. Patients if you are afraid of developing dementia, go and learn a new language. Anything which is new to you. Okay. Your physical activity, exercise is a very strong preventive measure because it increases the blood supply into the brain, which increases the nutritional supply. Diet. Last time, talked in anti-inflammatory diet. For example, omega-3 diet, less sugar. Sugar again is very, very high potent inflammatory. Antioxidants, huge antioxidant. Blueberries ke brain berries. Because it has a huge supply of antioxidants. Social interaction, isolation is also a cause of dementia because your brain doesn't get stimulated in the way it needs to be getting. And finally, spirituality is now considered to be a very good thing for your brain. There may meditation something that calms you down. Stress management is as important as brain exercises. Stress hundi, and your cortisol level high hundo, it will eat out your brain. If your brain is dementia, it really actually shrinks. CT scan means the brain has actually demented. It has lost its capacity. So let's understand dementia for 1 minute and then I'll stop. Stages of life, that's exactly what it is. What happens is that your memory starting from most recent going backwards. Language impairment starting from nala na yaad achan ya alfaz concept ache pe par unke alfaz na pa milan. Unkha wo language unkha wadik khatam thana shuru thindi. Sentences will become broken sentences, will become words. Finally, I have patients who don't speak. Physical strength khatam thini because that comes from the brain also. The reflexes slow thi venda, kiran shuru thi vendo manu. Finally, you are bedridden. Manje patients ji ya halat hai jo jadon ke mani nurses moh mein vijindiyo that they've forgotten to chew. They don't know what to do with this thing. In this personality changes, depression is very common. Psychosis is also very common. So it is really not a good part of life you want to end in. Nursing home is a hell of a place. And brain is your most important organ. So I think it is very important to understand how we can preserve our cognition. My take-home message is this: your elderly people don't take their memory loss casually. It is not a sign of normal aging. That is not a marker of good memory. That is abnormal. Get it checked. Change your lifestyle. Check kar analyze. There are medicines we can use to delay the progression of dementia. But once what is lost is not at this point can be gained. Thank you very much.
Say Akbar sahab la kini la question hai please वही कोई question को youth radar operation provision सादी हाँ say बदला साहब la कोई question है say Akbar sahab को say Akbar sahab की time का time
Mother, few words about the corrupt.
Yes, exactly what.
Not a
comment. I only want what would have been your take-home message of your second lecture. The take-home message only.
So, take-home message here that Japan is corruption we usually measure it in them earning wealth. But wealth is not, minje khayal mein wealth earning is not the driving force. There is more psychological disturbances. Is it power gaining, which they think is by virtue of wealth? So honey, cutting down to the final minute, here's the problem. All humans are born with a certain potential energy. We all have energy. That's number one. Number two, we all have need to be recognized and appreciated. Combine you have a blast of energy and you want to recognize. You at that point have a junction. You can go right or left. Right, you can do good things, channelize your energy into that and get recognized for those good things. Or you can do bad things. Take this energy and be recognized doing bad things. That's why Britney Spears shaved her head. This is the same psychology there. We good things path block literally. Let me give you an example. A student what is most glory? Getting first in the class. The energy and appreciation maintain kare thi. But je tawa number one achan ke appreciate na kanda, to who does not char manu golyu pa halain ta ma halaya. You get recognized that way. Think about it. So what can we do at a Sana level? We try to promote education, but we do not promote the recognition of excellence. We don't. I'm still cutting down to the last 15 seconds. Sports. Sports is a great way to channelize your energy and be recognized. What is our most common sport in Pakistan? Cricket. Wrong. Let's change it. Look at this. Cricket requires big ground. We don't have those. It requires green grass. We don't have water. It requires very expensive equipment. We don't have it. Summer aayote, garmi hai nawa mehina. Cricket is a 6-hour game. Kids don't play. Bottom line, cricket is now only on the screen. People don't play it. My suggestion, promote volleyball. What is volleyball? You play on the mud. You don't need shoes. You need one big ball, which is white. You can play at night when it is cooler. There 10 people play volleyball, cricket mein 13, but the difference is huge. If media takes on it, we promote showing volleyball. We recognize volleyball players. We have inter-school, inter-city volleyball tournaments. You play the amount of impact you will have on the energy and generalizing it. We all need recognition. Asamat you are last 10 seconds of that. Red light te nae beru mukhe ker jalindo. Right? That person is asking for recognition. But unwat sirf iyo hi ahe to babya disna to minister jo put pyo ane. But the same student in America will be recognized only if he does excellence in education, sports. Why don't we hold debate competitions? Bring the winner here. Recognize that
person. It's like basketball, volleyball, child grow,